I wanted to offer a practice that was going to be more encompassing, something, I guess you could say the word generic, but not necessarily so. This is still yoga therapy, but we're focusing less on a specific condition and looking at more of a broader scope of working with type 1 diabetes. And I guess you could apply this practice to type 2 as well, because our main focal points for this practice, which is one of protection and prevention, is cardiovascular health as well as stress reduction. Okay, people with diabetes are 3 to 4 times more likely to have cardiovascular disease, and it's something that it might be in the background of our mind, but it's something that we can be doing on a regular basis to be protecting our health. And part of that, it's like kind of like the chicken before the egg situation, you know, because stress affects it affects blood pressure, it affects cholesterol levels, it affects insulin resistance, right? But those things also are going to impact our heart health, and it's like it's all connected, right? This whole thing's connected. So when we're working with yoga therapy, we want to find a doorway in, and the best way in, at least in this form of practice, is by utilizing our breath and using that as a means to self-regulate the nervous system. It's a big one for us, is working with the regulation of the sympathetic branch of the autonomic nervous system and the HPA axis, which is responsible for the release of cortisol and our perception of stress. And then secondarily, working with the parasympathetic nervous system, which is the part of our nervous system that acts like the brakes to turn off the stress responses. So strengthening that. And then in addition, with this work of cardiovascular health, improving physical function, okay? Improving physical function. So I don't want you to see this practice as like a workout. If it's a workout, it's not yoga, let's put it that way. Yoga is not something that we're performing. It's something that we're practicing as a means of observing ourselves and observing the practice onto itself. And that's what translates into the off the mat work, which is really so beneficial when trying to create health for ourselves on so many different levels. And especially with type 1 diabetes, we're so plugged in all the time. And our ability to watch ourselves, watch diabetes, watch blood sugars, watch our mind, watch it all, but remain in that place of the observer, really gives us a leg up on our health, right? Because then we can make more appropriate choices that are coming from a place of knowing versus reaction. Okay, so I hope that gives you kind of an encompassing view of what this practice is about. You know, when I said the word prevention, there was a little cringe in me. I was like, wait, I don't want to put it out there that we all know we can't prevent type 1 diabetes. We already have it, but what we can do is prevent the onset of complications, right? And that's through this mechanism of protection. And we're doing this through stress reduction and working with exercising our heart. Just a little fun fact before we begin our practice, something that I didn't really realize until recently, is that if you look at the structure of our diaphragm, which is, you know, like our diaphragm's below, got my pump here, I got to get the stuff out of the way. The diaphragm's below the lungs, right? But there's something called the pericardium that surrounds our heart. Okay, and so there's connection from our diaphragm as well to the pericardium. So when we're breathing, right, the diaphragm is the engine of our breath. When we're breathing efficiently, it's also in a way exercising our heart. So this is not like our typical cardiovascular session where we're trying to like pump the jams and get the sweat rate up, but to use our breath and that efficiency of breath to exercise our heart in a way that's not, how do I say this? It's not going to be overly taxing, okay? And when we're thinking about blood sugar control as well, we all know that cardiovascular and anaerobic exercise have different impacts on our blood sugar. So kind of keeping this baseline, like a medium, allows us to just have better control over what's going on internally, both with blood sugars and beyond. So we're gonna start lying down. You start practicing. You can keep your video on if you want. Sometimes it's, to be honest with you, it's nice as a teacher to be able to see you guys moving, so I'm not looking at a blank screen. Hey, Isabel, I didn't see you pop in. Hi, welcome. Okay, so what you're gonna need, let me see if I can do the full view here of everyone. You're gonna need, I didn't mention this, but I would like you to have a rolled mat. So if you don't have two mats, that's fine. Just roll up the mat that you have pretty tightly. And so what we're gonna do is we're gonna start lying on the back, but we're gonna place the mat like in this mid back area. You wanna be able to have your shoulder blades on the ground. So we're going to start with just a little bit of an awareness exercise with the breath. So you'll get situated. Everyone's spine is a little bit different. So I like to lift my hips up and then slowly lower them so there's length happening in the low back. You're just going to take your arms out. You can keep the knees bent and the feet on the ground, or straighten your legs. And of course, if this doesn't feel good, you can do this work without the roll under you. This is a nice way to open the region of the chest. So please close your eyes. And begin to deepen and lengthen the breath. On the inhale, expand the rib cage and the lungs, and then relax the abdomen. On the exhale, draw the abdomen towards the spine. The low back will lengthen slightly, and you'll feel the ribs tethering together in the front of the body. So take a few more breaths like this, consciously shaping the inhale and the exhale, and presenting your awareness. So just keep breathing. I'll explain to you the breath practice we're going to start with here. So it's a two-part inhale. So please, wherever you're at in your breath cycle, please inhale normally and exhale slowly. Notice how when you exhale, you're contracting your abdominal muscles. And I want you to keep your abdomen slightly in. And then inhale for about 3 counts up into your chest and rib cage. Now pause there for 3 counts, relax your shoulders and experience your heart. Now inhale for 4 counts and allow your abdomen to expand and relax. Pause here, holding the breath, about 4 counts, relax, no strain. And you'll exhale for about 8 counts. Now, if that's too strenuous for you, please back off, but we're going to do this a few times, so you're going to get accustomed to it. So keeping the abdomen in, inhale for the count of 3. Pause for 3, experience the ribs, the heart space. Now inhale for 4, let your belly expand. And hold for 4, soften the shoulders. And exhale for the count of 8. Please repeat that. Inhale 3, expand the chest. Pause 3, experience the heart, the lungs, the chest space. Inhale 4 to the abdomen. Now pause for 4. And exhale for the count of 8. Now please just take a normal breath in and a normal breath out. I'm going to ask you a few times today to observe the effect of what you just did, and that was just 3 breaths, and you might notice there's a little bit of an effect here, both in your body, perhaps even in the mind, more present. Okay. So please interlace your hands just behind your head, and you're going to point your elbows towards the ceiling. So you're broadening the shoulder blades on the back of the body. And you're just going to take a breath in here. Now, as you exhale, draw the navel in and try to lift your head and shoulders up, but do so from the exhale. And maybe it's just like an inch or 2 off the ground. It's not a lot. And then you're going to inhale, lower down, and relax. So we'll do that again. As you exhale, draw the navel in. Lift the head and shoulders, maybe an inch or 2, but the head is relaxed as it can be. And then slowly release. Good. Now you're just going to shimmy down a little bit, so the rolled mat is going to be up another inch or 2, like at the base of the shoulder blades. And we're going to do the same thing. So you'll take a breath in. And on your exhale, draw your core to the spine. And lift up. Head as relaxed as you can. It's like an effortless effort. And you're going to slowly lower down on the inhale. So let's do that once again. Take a breath in and exhale, lift up. If you're doing this right, you could even poke your fingers in the abdomen. You'll feel quite a bit of firmness here at the navel. Okay, and then slowly lower down. All right, let's go just another inch or 2 higher. So that we're working here with the thoracic spine as well as the core. The thoracic spine is your upper back, and it tends to be the least mobile region of the spine. So we're just adding some mobility here. Take a breath in and exhale, lift up. Head and neck relaxed. As I'm looking out my window here, I see a hawk flying in the sky. It's very telling. Working on rising above diabetes, it's just soaring in a circular-like motion. Okay, good. Navel to spine, head relaxed. And then slowly lower down, and you can bring that mat once again to that first starting point, right under your shoulder blades. So we're in a slight lumbar extension, but nothing excessive, okay? Now, you're just gonna bring your legs together so the feet are on the mat, the knees are bent if your legs are straight. Inner thighs are together, and I want you to straighten your right leg forward, and you're gonna externally rotate your thigh, okay? So there's just a little bit of this opening in the front of the hip. Take a breath in, and as you exhale, really squeeze your right quadricep, and you're just gonna lift the leg up so it's in alignment with the knee, and then lower down. I know it's really slow and controlled movements, but the work here is about paying attention. So let's just do that a few times. You're not gonna relax the leg at all. You're just gonna lift and then lower down. It's really up to you whether you want to inhale or exhale with the movement, however suits you, but just as long as you're breathing. Let's just do 2 or 3 more. Really activating this, what we call the vastus medialis. It's the inner quad. If you want a little bit more challenge, you could lift the head up again, but make sure you keep it relaxed in the hands. Good. Okay, and then let's return back to center, and we're gonna just switch the legs. So when you're ready, you'll straighten your left leg. Externally rotate, so turn the toes out. And then energize, squeeze the kneecap, squeeze the quadriceps, and you're just gonna lift up. And if you want, you can take the shoulders up. Again, head relaxed, the neck is neutral. Anytime we're working so deeply with our core muscles and our hip, it's going to be really hard to take a complete inhale, and I actually don't want you to, because that's going to make you lose connection with your abdominal integrity. So just a smooth breath here. And paying attention to the transition of the movements. For instance, if your hips are rocking from side to side, creating quite a bit of physical stability and integrity, especially through the core muscles and hip muscles here. Okay, good. And then relax and walk the shoulders back just a little bit more. So you want to make sure you're kind of on that mid body region in case you scooted down like I did. I want you to straighten your legs. You're just going to flex your ankles, press through the heels, feel an inward rotation of your thighs, and then inhale. Take your arms up and overhead. Good. On your exhale, please bend your elbows. And you're going to bring your elbows a little bit lower than the shoulders. Inhale, straighten the arms. And now as you do this, please turn your chin to the right. And then exhale, bend the elbows and return the chin to center. So as the arms go overhead, that's when you turn your chin opposite direction now to the left. Inhale, straight arms. Exhale, bend elbows, head to center. Make sure your legs are active. You're not relaxed here. Well, you might be relaxed in the mind and the breath. The body is quite active. Just one more round on each side. Paying attention, breath and body. Okay, straighten the arms, keep your head at center. Flex your ankles, press the heels away from you, reach through your fingertips, and then exhale, lower your arms. And so to transition, you can bend your knees, roll over to the side. And just gonna move the mat out of the way. We're gonna do one more exercise here on the back. Okay, so now you're flat on the back. Give you a moment to adjust. And so we're gonna do a few variations of bridge pose, Setu Bandha Sarvandasana, but really working with this opening of the arms and the heart space. So consider this in a way a means of exercising your heart, okay? So I'm gonna have you open your arms so that they're in alignment with your shoulders. And actually, why don't you turn your palms down? It's a little less natural. And so you'll drive into your heels, exhale, and lift your hips up. So really pressing into your heels. And now as you lower, slowly at once, lower the pelvis and reach through your fingertips. You'll notice an opening through the front of the body. And you'll please repeat that. Inhale, press into your heels. So you're contracting your glutes and your hamstrings. And slowly lower, energize through the fingertips on the lowering portion. Now turn your palms up and you're going to take your arms behind you. If you were like a clock, your arms would be at like 10 of 10 after. We're going to do the same movement. So inhale, lift up. And exhale, lower, reach through your fingertips. And you'll start to notice like a suctioning, hollowing out action of the abdomen, especially as you reach your arms away from you. Good, now take the arms straight up and behind you. And let's do 2 more rounds. Good. And slowly lower your hips, lower the arms, and just draw the legs into the body. Just a gentle Apanasana here, holding the pose. Rock from side to side if you like. Okay, so from here, please roll over to your side, and we're gonna transition coming up to all fours. Okay, so tabletop position. Inhale, lift your chin and lengthen the front of the body. On the exhale, draw your chin in and shift your hips towards your heels, bending your elbows, lower the torso to the thighs. So this movement is called Chakrabakasana, rather. It's like the ancient version of cat-cow. Traction the hands and slowly begin to articulate your upper back like cobra pose. You feel there's a back bend, and then at the very end, lift your hips up. And exhale, repeat, and press your abdomen as you go back. So it's very gentle. I highly recommend, even if you feel comfortable, closing your eyes so you can witness the connection of breath and the movement of your spine. Breath is nice and even. Okay, on your next exhale, please come back. And you're going to stay there You can bring your legs a little closer together. And so we're going to take this into a lateral variation. You'll walk your hands over to the right. Elongate through both sides. You want to be mindful you're not compressing through that right side. Reach your fingertips as far away as you can. And even place the left hand on top of the right. And let your head relax between your arms. Sit back through your left hip. And as you hold this lateral stretch, breathe into the left side of the body, the lunar side of the body. Good. And then we'll go over to the other side and stretch to the right. Directing your breath into the right lung, right rib cage. Anchoring down through the right hip will increase the side body effect. Okay, good. Now let's come back to center. Up to all fours. And step your left foot forward. Just come up to like a simple lunge. I don't know about you guys, but it's been a long time since I put stretchy pants on, and I don't like it. I like my sweatpants. What happened? This used to be the comfort, and now it feels constricting. Okay. Not to mention, it's hard to keep your pump in place with them. So if you need some extra support, fold your mat in half. So you're just going to come up to a lunge position. You can see this rather straight angle. That's what we want. I'm going to lengthen the spine. And so as you inhale, I just want you to bend your front knee a little bit, and you'll reach your right arm overhead. This is not about going very deep into the lunge, so don't like collapse forward, but really try to create as much vertical space as you can. And so let's do that just a few times. Inhale forward. And exhale. Good, one more time. Now, from here, energize up through the right fingertips. You can let that right shoulder blade elevate, and you'll bend your elbow. Grab hold of the nape of your neck with your hand, and just lift into a gentle extension. And as you breathe, focusing on the ribs and the chest. Keeping your abdomen engaged will help to support the movement of the breath up and into the heart region. And you can sense perhaps that this is building a little bit of internal heat in the body. Good, one more breath in, lengthen, and then slowly release. All right, really simple. And just switch sides. You can try to do it without your hands. Okay, good. So breathe in and out. If we had more time, perhaps we would hold some of these postures longer. But I want you to get a full experience. Okay, so holding the pose, reaching up, bend the elbow, grab hold of the neck, creating a little bit of a cervical traction here. And so you're reaching up through the elbow while simultaneously pressing down through the top of the back foot, and maintain breath. Lots of sensations in the body. Your awareness stays present. There's an ease and a quietude to the mind. Okay, slowly release. Well done. So just pause for a moment, place your hands on your frontal hips, and observe what you notice in both body and mind. Perhaps even more awareness of the heart and the beating of your heart, that efficiency of blood entering and leaving this vital organ, and the circulation to every part of your body. Okay, so please come back down to all fours. Next is a little bit of a twist. It's very, very subtle. So you're going to press into your hands. Allow the backs of your arms to really activate, so your shoulder blades in the back are broadening, okay? The navel is slightly drawn in, so you're more neutral than in a back bend, okay? Now, placing your right hand behind your head, and you might even bring your left hand more to the center as an anchor point. What you're going to do as you exhale is twist to the right. Now, I'm not trying to go for the deepest twist here. What we're really trying to feel is this contraction and churning of the right side of the belly. So you'll inhale to center and exhale to twist again. Be mindful as you continue this that your twist is originating from your exhale rather than you know, cranking your head. That happens. It's quite telling, you know, what's going on here with the mobility of the upper back. Okay, good. Let's switch sides. So I know a few of you are teachers, and I just want you to also link with the fact that I'm bringing a lot of awareness to the navel and the movement of prana inwardly, which is samana vayu. So with each exhale, squeezing the belly. But we're not doing a lot of overt rotation. We're really focusing more on the exhale to stimulate that activation of navel in. Exhale is what helps us regulate the autonomic nervous system. It's inherently, it puts on the brakes, so to speak. When you lengthen your exhale, that's what turns on the parasympathetic branch. Okay, so let's come back to center and just bring your hips towards your heels and relax. So we're going to combine a few movements together, and you're welcome to watch this first round if you're more visual. This is Vajrasana with a little bit of rotation. So from here, place your hands at your low back, and then inhale, open your arms, and you're going to stand up on your knees, take the arms overhead, squeeze your glutes a little bit, really lengthen through the spine, and then as you exhale, you're going to twist. Inhale, come back, arms overhead. Exhale, twist, other direction. You can even turn the head over the shoulder, looking over the fingertips. Inhale to center. And now you're going to do the same in reverse. So you're going to open the arms, bend forward, torso to thighs, forehead down, and then at the end, hands to the low back. Okay, so let's do that again. Inhale, open the arms, stand up on your knees, squeeze your glutes, arms overhead. Exhale, twist, rotate from that exhalation. Feel your obliques activating. Inhale, arms overhead. Exhale, twist. Inhale. And exhale. Again, inhale. Arms up. Exhale, twist. Arms in alignment with the shoulders. Inhale. Exhale, twist. Inhale. And then bending forward, exhale. Abdomen contracts. Hands to the low back. Good, and just relax, arms by your sides. You can stay here or seated, whatever is more comfortable for you. Take a few breaths to regulate, to let the heart rate slow down. And to link once again with that sense of balance and we call homeostasis. It's really a feeling more so than a thought. Okay. Now from here, we'll slowly transition and make our way up to standing. Just gonna adjust. Now, if you have something to place between your legs, you could do your rolled mat, or if you have a block, that would be ideal, or even a pillow. Okay. Stand back just a little bit. So I like to have something between the legs. I feel like it creates quite a bit of this energy moving in, and that's what we're trying to recreate by the twisting and the exhales. So we're going to work with a variation here of Urdhva Hastasana, which is an arms overhead position. Okay, and then we're going to add on some awareness of the breath. So, okay, squeeze it in. As you inhale, you're going to take your arms overhead. When the arms are about shoulder height, flip the palms up and then continue reaching your arms overhead. So just be mindful as the arms are overhead, you're not back bending quite yet. You're just trying to create as much length as you can. Let the shoulder blades lift. And now exhale, open your arms, keep the palms up, and you're going to bring your pinky fingers together, squeezing the block powerfully. Yeah. Now inhale, same thing, arms overhead. Now as you exhale, open the arms, but turn your palms down and bring the thumbs together. Inhale, open the arms, palms up, reach up overhead, lengthen through the side. Exhale, arms by the sides. And so the palms will face down and you'll stand up nice and tall. Okay, let's try that again, but this time we're gonna add some back bend too. So I'll give you a profile view. So everything from the nail down is going to be quite firm. As you inhale, open the arms, lift up. You can look up and just create a little bit of a back bend. Exhale, stand tall, pinkies together. Squeezing whatever's between your legs. Inhale, arms overhead, little bit of extension. And then exhale, thumbs together this time. Inhale. Little back bend, press the pelvis forward, look up. Exhale, return to center, lower the arms, stand up nice and tall. Take a breath in and out and feel quite a bit of activity and circulation, warmth in the body. Let's do another round like that. Go for an even breath in. And so I realize there are many different styles of practicing yoga. Originally I was a vinyasa teacher, which is quite a bit of like forward bending and connecting things, but also with the breath. And what I want you to start to get a sense of is that there's a benefit to movement and then there's a benefit to stay. But so long as we're maintaining the integrity of our breath, that's really where the healing comes from, and our ability to witness the transitions, witness the practice, and witness ourselves. Take a resting breath in and a resting breath out. You just let heart rate slow down a little bit. Okay, so you can remove that. Just put it to the side. So now we're going to work with a version of triangle pose. Let me see here. To take my legs and the camera in a different angle. So you're just going to see kind of part of me, but the most important thing is you see my torso here. Okay, so your feet are relatively even. I'll mirror you, so you're going to turn your left foot out. Okay? Yeah. However it works. This is really my right, but if you're facing the screen, it's going to be your left. And so you're going to open your arms. You can turn your right palm up. Now, as you exhale, I just want you to bring your hand to your shin and then continue taking the arm overhead. This is the same exhale. If you feel good, you're going to look up. And now as you inhale, you're going to return all the way back up to the starting position. So let's do that again. Exhale, go into triangle pose. And so a lot of intentionality here, especially on the navel. Feel that with each progressive movement, the exhale is bringing you into it. Now let's exhale for the count of 5, okay? Inhale to come up. Exhale for 6. Exhale 7. And now exhale for 8. So please stay here in the pose. Take a breath in and lengthen. Now as you breathe out, use all that turning we've done and just turn the right side of the navel towards the ceiling. Inhale for length. Staying in the pose. Exhale, turn. One more breath here. Inhale, lengthen. Find that stability. Exhale, turn. Good. Now let's inhale, come back up. Please parallel the feet. So turn your left foot in, pause for a moment, and observe energy through the right side of your body. All right, now let's go to the other side. So turn the right foot out. And you'll open your arms. I'm going to bend my knee a little bit. I have a hip injury on this side. So you'll turn your left palm up and exhale. Come into the pose. Continue reaching the arm overhead. And if it feels all right, look up at the hand. Inhale, return to the starting position. Okay, exhale. And I'm putting my hand here just so you can sense I'm really focusing on the navel. Drawing in. And inhale. This time, exhale for 6 counts. So we can learn from the movement to pay attention to the transitions. Exhale 7. And now exhale 8. And now we stay and see if you can maintain that same 8 count exhale. Turning the navel to the left on the exhalation. Now we learn and stay how to maintain stability and ease. It's kind of like diabetes, it's constantly moving, constantly changing. But we learn how to maintain stability and ease. Wonderful. And slowly come all the way up, parallel the feet, and observe now the left side body. If it's comfortable, the eyes can soften. And so we worked with both sides. This helps to promote this sense of balance now. Okay, so just a few more movements and bring your feet closer together. So we're going to work with a couple different movements. I'll teach you the movements and then we'll add something called breath suspension, which is a slight pause after your exhale. Very powerful in terms of invoking a physiological response. That's something that's going to affect your nervous system especially. So you're going to go to all fours. This is one of my favorite movements, especially for core strength. So you're going to tuck your toes under your feet. Okay, bring your weight into your fingertips and broaden your shoulders. Now as you exhale, I just want you to lift your knees up an inch or two off the ground. Okay, really feel quite a bit of core integrity as well as arm work here. And now you're going to lower the knees down, point your toes, and shift your hips back to your heels. That's your exhale. Now as you inhale, you come back up. Exhale, tuck the toes, return to that same position. We call this bear position. Now, keeping the knees bent, I want you to press back. That would be another breath here. And then progressively straighten the legs, down dog. Okay, it's a short down dog. That's okay. The knees could stay bent. Now inhale, return to bear pose with the knees hovering. Please take an inhale here. And then lower the knees on the exhale, hips to the heels. Inhale, come up. All fours. Exhale to bear pose. Please stay here and inhale. Exhale, down dog. The legs could straighten at the very end of the movement or the knees can stay bent. Inhale to bear pose. Lower the knees, exhale, hips to heels. All right, so you can stay with that. If you feel like you're in the flow with it, we're going to add the pause after the exhale. So come up to all fours on the inhale. Exhale, bear pose. Hold the breath out for a moment. Take a breath in. Now exhale to down dog. And at the end of your exhale, you're going to pause like 1 or 2 seconds. Holding the breath out. Inhale to bear pose. Good. Lower to the knees. Exhale, hips to the heels. Bend the elbows. Now pause at the end of your exhale. 1 to 2 seconds. Let's do another round. Inhale, come up. Exhale, bear pose.
Hold the breath out 1 to 2 seconds. Feel the navel. Take a breath in. Down dog, exhale. Pause after your exhale, 1 to 2 seconds. Inhale, bear pose. Lower to the knees, exhale. Hips to heels, pause. 1 to 2 seconds. And then relax. Either embryo pose with the arms by your sides or in a seated position, whatever feels comfortable to you. And take a moment to adjust. A different kind of work here on the heart. Okay. So I'd like you to transition onto your back. And we're going to do a side bend. This is called Jatar Parvriti. You guys can see me okay? Yeah. Okay. So, straight legs. And now you're going to walk your feet over to the left. It doesn't have to be very far. And then you'll shimmy your shoulders over to the left. And you'll reach your right arm up and behind you. Now, if there's any shoulder limitation, you could place like a pillow under the arm. The left hand will rest at the abdomen. Or if you want a little bit more activity, you can grab hold of the wrist. If it's comfortable, please close the eyes. And now what I'm going to invite you to do is inhale just into your abdomen. So you're going to bypass the chest. And exhale, just nice and slowly, without hurry. Inhale into the belly. Bypassing the chest. Exhale slowly. So your exhale surpasses the inhale. More breaths like that. If counting the breath is helpful, I'm going to recommend something like 4 counts in and 8 counts out. This type of breathing, lengthening the exhale, it's very soothing, calming, and internalizing for the mind. And then slowly release the right arm, walk your legs and shoulders back to center. Let this airplane pass by. And now let's bring the legs over to the right. Shoulders over to the right. So you're creating this crescent shape. The left arm behind you, right hand at the abdomen, or you could grab hold of the left wrist. Come back to the 1 to 2 breath. Inhale for 4. And exhale 8. Nothing to do, just to be. Each exhale, calms, soothes any hyperactivity of the mind. Allowing the mind to rest in the body. Slowly lower the arm, walk your legs back to center. And now you just bend your knees. Lift your feet up, place your hands either on the shins or behind the knees. Elbows are going to straighten, and this is Apanasana but dynamic. So on your exhale, just gently draw the legs towards you, keeping the sacrum down. Stretch your low back. And inhale, elbows straighten. Try to go as slow as you can, maybe even maintain the 8 count exhale. And if you want even more calm, that pause 1 to 2 seconds after the exhale is going to be a great addition to this. So you could exhale for the count of 8. And pause 1 to 2 counts. Good. Slowly extend your left leg forward. Let the toes splay open. Extend your right leg forward. And just make any adjustments you need. We're going to rest here for about 3 to 5 minutes. Palms face up. If you're in a very bright room, you can cover your eyes with a towel or a strap. Relax the whole body. Rest in the awareness of sensations. Or the awareness of the natural breath. Let go of all holding. Let go of all effort.
Okay, please slowly come back to your breath. Progressively deepen the inhale and the exhale. And you'll slowly take your time and roll to the side and press up to a comfortable seated position. I'm going to be seated for the remainder of practice. So if you're more comfortable in a chair, by all means, please sit in a chair. I certainly am. So we're going to work with the exhale even more. Something about the exhale, especially for type 1, I won't even tell you. I mean, I don't want to even project onto your experience, but for me personally, this is one of the most healing things that I can do on a regular basis. So I'll let you experience it for yourself. We want to exhale without tension. So if any tension arises, please recognize it and know that you can do less, okay? Please close your eyes, sit up. So we'll be working with exhale and the pause after the exhale. Now let me remind you that the pause, it's not when your lungs are completely vacated. That's impossible and it will create tension. So just a comfortable empty. I'd like you to find the 4 count breath in and the 8 count breath out. And for this work, your inhale, let it happen more in the abdomen than the chest. Inhale for 4. And exhale for 8. Your own personal count, however fast or slow that may be. Please do a few more rounds like that. Inhaling 4 and exhaling 8. So now please inhale for the count of 4 and exhale for 7 counts. And at the end of your exhale, pause for 1 count before you inhale. And you'll repeat that 2 times. Inhale 4. Exhale 7. Pause 1. Inhale 4. Exhale 6. Pause 2. Repeat that again. Inhale 4. Exhale 6. Pause 2. Inhale 4. Exhale 5. Pause for 3. Inhale 4. Exhale 5. Pause 3. Inhale, 4. Exhale, 4. Pause, 4 counts. Inhale, 4. Exhale, 4. Pause, 4. The more you relax, more shallow and subtle the breath will become. Relaxing into that deep, infinite in at the navel. And soon it may be that there's more pause than breath itself. Relax all tension. The deep, abiding pause where the mind stops. The pause is anything but empty. The deep center of your being is full, complete. Please find your breath again. And as you breathe into this vessel of your body, experience the breath permeating every cell, every organ, extending from the heart, nervous system, balance. Please, as you breathe, it's simply um, an invitation to remember how sacred your life is, to recognize the hope in this language of self-regulation we learn from yoga, this hope we learn by changing the way we feel and experience, perceive the world inside of us and around us. And that remembrance that it comes from you, this experience is you, that health is from you. So with that gratitude and remembrance, just begin to rub your hands together. And you can place the hands over your eyes, open and close your eyes, a few more deep breaths. Please come back at your own time. It's helpful to hear how others feel. So I know we're at the time here, but if you want to say a word or two, that way this feedback allows us as a group to know that we too can experience these things. I feel very centered in my body. I feel vibrant. I feel very alive. I'm not so worried or distracted. I don't know where my BG's at. I'm 104. Okay. So the more and more you practice, the more and more this kind of thing, it's easier to return to. It's a baseline practice. I would say it's beneficial for everyone, with or without diabetes. That these are elements of what I'm noticing within myself with type 1 and with my other students with type 1 is, like Sabella said, it's like we're not gasping, we're not grasping, and we're not panicked. Everything's okay. That home is within us, right? And if we can apply that in the moments where it doesn't feel like it feels like complete chaos, what a huge life preserver that is, right? So if we can practice, it helps us build up our resilience to stress, but then in the midst of stress that we can apply these practices as well. So both as like a baseline protection, but also as a tool for when things are chaotic. So for the Rise Above program, it starts in 2 weeks on March 15th. It's like an experiential practice of what my book is based off of, but geared to type 1. So there's one more week to sign up for it. Let me know if you have questions. You guys have my email. I'm always available if you want to talk on the phone. But I love to walk you through these practices. And in the Rise Above program, we're going to be going into specifics. Hypoglycemia, how to work with insulin resistance, how to work with postprandial spikes, because they're different kinds of things, recovering from hypoglycemia, diabetes burnout, gastroparesis, like so many different things, as well as different Ayurvedic techniques that we can start to apply as well, both in our food, but in self-care practices. So it's very encompassing. And I just want to thank you for joining me. It's been a really long time. This is my first real asana practice back since I had surgery last year. And I've been teaching for, like 15 years. And so I full-time teaching. And so I really miss this. I was really looking forward to this. And I want to thank you for sharing that with me. So thank you. And if any questions come up, like I said, just reach out to me.